Welcome to The Explainer. Today, we're unpacking something absolutely crucial. Yet, it's something that's so often hidden behind a heavy veil of societal expectations: the complex physical and emotional realities of pregnancy and the postpartum period. We are going to break down the hard science behind what expectant parents actually go through, peeling back the stigma and replacing it with pure, empowering knowledge.
So let's just dive right in and confront a massive misconception right out of the gate. Is pregnancy always a perfectly happy time? Society loves to paint this picture of glowing, unbothered joy for 9 straight months. But let's be real. For a lot of expectant parents, that is simply not the case. The expectation of constant happiness can actually make the very real, very biological struggles feel incredibly isolating. Today, we're going to validate those struggles by looking directly at the data.
Here is our roadmap for today. We'll hit the reality of pregnancy changes, hormones in your mental health, perinatal depression and childbirth fear, safe medication during pregnancy, and finally, finding support and healing. Let's get to it.
Section 1. The reality of pregnancy changes, both physical and emotional. 85%. When we talk about the first trimester, morning sickness, the nausea and vomiting is one of the most widely expected side effects, right? And man, it can be physically draining and just emotionally taxing to feel sick all the time. But here's the wild part. The data shows us that 85% of nausea and vomiting actually resolves by the second trimester. It's a great reminder that while these physical symptoms are super intense, a lot of the most jarring changes do have a biological endpoint.
If we map out the timeline, the first trimester brings the nausea, fatigue, and major emotional shifts because, well, your body's realizing it's literally growing a human. By the second trimester, emotions often stabilize a bit, but then the physical changes really kick in, like swelling in the feet and ankles. Then, rolling into the third trimester, we see Braxton Hicks contractions, which is basically the body physically practicing for labor, along with severe sleep difficulty just from pure physical discomfort. And finally, the postpartum period involves these rapid, massive physical adjustments. Bottom line, your body is doing incredible, exhausting work every single step of the way.
Moving on to Section 2. Hormones and your mental health. Let's look at the biological why. Get this, up to 40% of mothers report feelings of anxiety or depression during the perinatal period. 40%. That stat alone proves that experiencing mental health struggles during pregnancy or postpartum is absolutely not a personal failure. It's not a character flaw, and it's certainly not something you're doing wrong. It is a highly, highly common biological reality. So let's pop the hood and look at exactly what's happening. The key here is understanding this crazy hormonal tug-of-war happening inside the body. During pregnancy, hormones like progesterone and estrogen rise steadily to support the baby. But right after delivery, boom, there is a sharp, sudden decline. And since progesterone helps regulate mood and anxiety, this sudden drop acts as a massive trigger for postpartum depression. It's literally a biological crash. But hey, it's not all challenging. On the flip side, we do get some beneficial boosts. The body actually ramps up production of oxytocin. You've probably heard it called the love hormone, which actually acts as a natural stress and anxiety reliever. Basically, your mental health is just riding on these massive biological waves.
Section 3. Perinatal depression and childbirth fear. Let's talk about the specific clinical conditions.
Postpartum depression, or PPD, occurs in roughly 1 in 7 women, and it usually shows up within the first 6 weeks after childbirth. Now, this goes way beyond just the baby blues, which typically clear up in about 10 days. PPD can cause really significant distress, impacting a mother's relationship with her baby and just her day-to-day functioning. Honestly, 1 in 7 means that if you're watching this right now, you either know someone who has experienced this or you might have experienced it yourself. Beyond depression, there are also some highly specific anxiety disorders out there like tocophobia. If you haven't heard of it, tocophobia is an extreme, paralyzing fear of childbirth. And it actually comes in 2 types. Primary tocophobia happens in folks who have never been pregnant, while secondary tocophobia develops after a traumatic event during a previous pregnancy or labor. We're not just talking about your run-of-the-mill nervousness here. This fear is so intense it can literally cause people to completely avoid getting pregnant, dread every single week of their pregnancy, or even request medically unnecessary C-sections just to avoid a vaginal delivery. It is a very real clinical condition, and it absolutely deserves validation and care. All right, Section 4, safe medication during pregnancy. Let's break down the 2023 guidelines from ACOG. That's the American College of Obstetricians and Gynecologists. If a patient needs medication, ACOG recommends SSRIs, think sertraline or citalopram, as the absolute first-line treatment.
Actually, Searchline is heavily preferred because it has such a well-established safety profile. SNRIs are also considered a totally reasonable alternative. But here's what's incredibly exciting. There's a newly approved medication class called synthetic allopregnanolone, a medication called zuranolone, which is just a 50 milligram daily oral pill taken for 14 days, is now highly recommended for treating severe postpartum depression. Why? Because it actually mimics those exact hormones that violently dropped off after birth. It's a real game changer.
I really want to highlight this direct quote right from the clinical guidelines. Withholding or discontinuing antidepressant medications during pregnancy is not recommended, as discontinuation is associated with an increased risk of depression. You guys, the medical consensus is remarkably clear on this. The benefits of maintaining your mental health stability with medication heavily outweigh the really minimal, inconsistently described risks. You absolutely do not have to suffer through pregnancy unmedicated if you need the help.
But you might be wondering, what about more complex medications, like, say, lithium for bipolar disorder? Well, pregnancy physically changes how drugs work in your body. Because your fluid volume and kidney filtration increase so much during pregnancy, lithium levels can actually drop dangerously low. So to keep patients safe, clinical guidelines require some very specific monitoring steps. Step 1, monitor blood levels every 3 weeks until week 34. Step 2, bump that up to monitoring weekly until delivery. Step 3, use twice-daily dosing just to minimize those peak side effects. And finally, Step 4, target a slightly higher blood level, greater than 0.8 millimoles per liter in that first month postpartum, simply because the risk of relapse right after birth is exceptionally high. It's kind of like walking a tightrope, but with proper monitoring, it is absolutely manageable.
And finally, Section 5, finding support and healing through community programs.
There are some really incredible, evidence-based community programs out there. Take the ROSE program, for example, which stands for Reach Out, Stay Strong Essentials. It's this preventative framework of prenatal sessions that has been clinically proven to cut postpartum depression by 50% in low-income women. 50%! That's huge. Beyond that, organizations like Postpartum Support International, or PSI, offer this amazing array of targeted, completely free online peer support groups. Whether you're dealing with ADHD in pregnancy, navigating the medical system as a BIPOC birthing person, sitting in the NICU with a medically fragile baby, or grieving a pregnancy or infant loss, there is a dedicated space for you. You don't have to explain your trauma from scratch. You can literally just sit with people who instantly, deeply understand.
As we wrap up this explainer, I want to leave you with a thought. Maybe a challenge, really. How can we better support the mothers and birthing parents in our own communities? We've looked at the hard biology today. We've seen the clinical guidelines, the medications, the whole shebang. But the final piece of the puzzle? It's empathy. It's transitioning from just knowing these clinical facts to providing tangible, real-world support. Maybe that's dropping off a hot meal, listening without an ounce of judgment, or just holding space for someone whose pregnancy's feeling more like a struggle than a joy. The biology is tough, no doubt about it, but empowered healing is completely possible when we combine that medical science with genuine human connection. Thanks so much for joining me today, and keep asking the right questions.